Come along with us to the Merredin Medical Centre. We're the Yep crew and we're going to ask them a couple questions about what they can offer young people to do with sexual health and STI testing.
Hi, how can we help you today?
What would you like young people to know about your service?
So just to let you know that we're non-judgmental, we're confidential. The receptionists and the nurses don't need to know what you're here for. We can treat your STI straight away. If money is a problem, obviously the medication is free, but you can discuss with your GP and ask for a bulk bill appointment. If we need an urgent appointment, we can do so and fit you in for that day to be treated.
So Katy, how would you know if you had an STI?
Sometimes you don't actually know you have a STI. It's the best to get tested every 3 months or in between each sexual partner.
What do the symptoms of an STI look like if you do have symptoms?
DRIP's acronym. So there's discharge, rash, itch, pain or pus and sores, or you might not have any symptoms.
So how do you test for an STI? What's involved?
So it's usually a blood test and or a urine test, or sometimes a swab. You can take your own swab from a vaginal swab, anal swab or a throat swab. So the blood test, we just go up to the local hospital at Path West and they'll take some bloods. They're absolutely fantastic at taking bloods.
How can I find out about my results and also what happens to them?
So the results come back to the surgery electronically. The doctor reviews them and lets the receptionist or the nurse know to contact the patient for an appointment. The receptionist or the nurse don't know why you need an appointment, and sometimes the results can be notified to you by phone. So if it's a notifiable disease, then there may be some follow-up from public health to let you know that you need to let your contacts know. So public health aren't going to let anyone else know in town. If you are concerned about your parents or someone else knowing, then just let the receptionist know that you would like all the results to come to your own personal phone number, and there will be a text to say you have results, please contact the surgery.
If I wanted to see someone of a particular gender, is that possible here?
Please let us know if you would like a particular gendered doctor, and we'll do our best to accommodate it, but particularly on some days of the week, then we just have one doctor available and there is not much choice. But the doctors are very confidential, very understanding and won't make you feel embarrassed.
So what can happen if I'm too shame about getting tested and I keep putting it off?
It causes you a lot of stress, just that constant worry that you might have an STI. If you do have an STI, don't get tested and don't get it treated, then you can get very sick. You can prevent you from getting pregnant in the future. If you're pregnant, it can be very dangerous for your baby and cause lots of stress for you and your child. And if you continue to have unprotected sex with others, you spread it around your small community. Just remember there's no shame in getting tested. It's just another infection that we can treat, especially if it's early.
If you had one message for the young people about STI testing or the Merredin Medical Centre, what would it be?
Test early, test often, and you're very welcome at the Merredin Medical Centre. Hope to see you soon.